Hello everyone, this is my next lecture on routes of drug administration, which is a very good topic of pharma and can be a potential long answer question in university exams if you are a second year student. So let's begin. First of all, the route of drug administration is divided into two types, the systemic and the local type. Systemic, we all know the whole body will be involved in this, and in local, a particular area of the body will be involved. So let's look for the systemic first. The first type of the systemic is intranasal. So in intranasal, we will look for the benefits and the drawbacks of intranasal route of drug administration. The benefits are peptides can be used for CNS and they will bypass the blood-brain barrier through intranasal state. Peptides, as we all know, they are larger molecules, so they are not being able to pass through the blood-brain barrier. But if we actually administrate them through intranasal state, it will be able to pass through. The other benefits are like it has a rapid effect and ease of administration as well. These are the three benefits. First is the peptide can be used for CNS and it can bypass the blood-brain barrier. Second, it has rapid effect and there is ease in the administration. Now the drawbacks. Only high potency drugs can be used because of their lesser dose amount. Because intranasal we cannot give in a large amount of the drug, as we all know. So that is why only a high potency drug can be given. This is the drawback, the only drawback. Now moving on to the examples of intranasal route of drug administration. The examples are gonadotropin releasing hormone. Just remember, in intranasal there will be all the hormones, like and the only example you have to remember is the desmopressin. Here the desmopressin, the name itself has pressin, so you can think of it's related to nose. So gonadotropin releasing hormone, the antagonist, desmopressin, calcitonin, again the hormone, and phentermine, which is an opioid. Moving on to the second type, which is pulmonary, will be given it through as an inhalation, right? Like nebulizers and all. So it has two different effects, the systemic effect and the local effect, the pulmonary inhalation type. The systemic effect and the example of systemic effect is Afrezza, which is an inhalation type of insulin, and it is actually used in postprandial hyperglycemia state in diabetic patients. So the benefits of systemic effect of inhalation is rapid absorption and effect and no first pass metabolism, but the drawback is cough and bronchospasm can be present. The local effect can be it affects the it helps in beta 2 agonist. As we all know, beta 2 is present in the endothelial cells of the vessels and also in the bronchioles. So it helps in vasodilatation and it also causes the anticholinergic effect. So that is why it is used in bronchial asthma, as it causes the bronchodilation, and COPD is chronic obstructive pulmonary diseases. The benefits of local effect can be rapid action and systemic side effects can be absent because since it is local effect. Now moving on to the third type, that is sublingual. Sublingual, it is its drawbacks and benefits. Sublingual, below the we put the tablet in the tongue and let it absorb. So the benefits, first, it has rapid effect, of course, because it quickly enters to the dorsal lingual veins that are present below the tongue and gets absorbed from there, and literally directly enters to the superior vena cava. I'll talk about this just in a while. So it has rapid effect. There is no first pass metabolism as it directly enters to the veins. Third, the drug can be spitted out after desired effect. After getting an optimum effect, we can spit it out. The drawbacks can be it can cause teeth decoloration and decay. The caries can occur, dental caries. And the other side effect is cardiac side effects, only in few cases. Just because it enters directly to the superior vena cava, very quickly enters to the superior vena cava, it actually, the drug is directly lead to the heart. So it can cause cardiac side effects. These are the side effects. Moving on to the examples, the nitroglycerin, the isosorbide dinitrate and isosorbide mononitrate. You can write as many as you want. These two are the nitrate groups. This is the short acting, this is the long acting. I will deal with it again, and you hear these medicines again in these drugs again in angina, treatment of angina, and I will definitely deal with it again. So just remember, nitroglycerin, it is also known as NTG in a short form, and isosorbide dinitrate or isosorbide mononitrate. It can be buprenorphine, ephedrine. Ephedrine is an important example as it is used as local anesthesis, and can also be used for nasal decongestion, as I am having it right now. And the other example, it's not very needed. If you want to, you can just note it down. Next, moving on to the oral route of drug administration, which is the most common type, MC, most common type. The benefits of oral, it's the cheapest, convenient and safest. Now the drawbacks, there are many. First pass metabolism, it is present, and variable absorption. Since it is oral, so everyone have different sort of absorption abilities based upon their food intake, the enzymes or HCl presence. The drug properties, again the drug properties, it can mainly depend on the lipid solubility of the drug and the size of the drug. Now why size matters? As you all know, many drugs are proteins, right? So protein has large size, so it cannot be given oral because it won't be able to absorb. Now how can we identify the drugs that are protein? So for the identification, just remember the drug should end with these three endings or the suffix: the ACE, the tides, and the MAB. MAB is for monoclonal antibodies, ACE for enzymes, and tides for peptides. So ACE like asparginase and rasburicase. Tides can be octreotides, nesiritides, and MABs can be trastuzumab and rituximab. Now, oral tablets can be in form of tablets or in form of capsules. Now, the benefits of capsules can be three. First, extended or sustained release. So, the action could be longer, duration of action could be longer, and there can be a controlled release that can lead the increase in half-life. Which is actually used for shorter acting drugs, which has shorter half-life, which degrades quickly. The other is enteric coated. So these kind of drugs are acid labile and thus are easily destroyed. The capsules are easily destroyed by the HCl. Now moving on to the next type, which is intravenous given through the veins. Now the benefits first, it is again a very important topic, the intravenous type. Benefits, it is the most rapid effect. It has the most rapid effect because it is directly given to the veins and it can affect directly to the systemic circulation. So it is used in emergency. There is no first pass metabolism, which is an important feature. Also, it is the only route which has 100% bioavailability. BA is for bioavailability. It has 100% bioavailability, which means the drug, if you are giving 100 mg of a drug, the 100 mg will be effective for the particular effect we want. There won't be nothing that will be wasted off. This is the benefit, as it bypasses the first pass metabolism. A large amount of drug can be given. These are the four important benefits you have to remember. Intravenous route of drug administration itself can be a short note, and the oral route it can also be a short note. Now the drawbacks, it can cause infections, like because it is given through injections, it can cause infections because it is piercing the veins. The drugs that are given through intravenous are mostly oily medium, so it can lead to hemolysis. This can be a side effect. Now the examples can be intravenous adenosine, which is a drug of choice for paroxysmal supraventricular tachycardia, PSVT, paroxysmal supraventricular tachycardia. Nicardopine, which can be a drug of choice for hypertension in emergency cases, and lorazepam, which is a drug of choice for status epilepticus. Moving on to the next time, which is intramuscular. The benefits, Drug in oily medium can also be used. So the duration of action could be increased of the drug because it is in oily medium, so it is lipid soluble and it can be slowly absorbed through the muscles. Now, drug that can't be given through oral route can also be given through intramuscular route, like proteins. Especially oral route cannot be given through proteins. So proteins can be given through intramuscular state, like MAPS, as we all have heard, monoclonal antibodies. The drawbacks of intramuscular, again, pain on the injection, it can be happening because of the oily medium. It can cause potential nerve injuries if it is not given in a particular way of the muscles, and it can cause infections. Now the examples, like monoclonal antibodies, which are anti-tetanus serum, tetanus toxoid, epinephrine, and antibiotics can be given. Now moving on to the subcutaneous state or route of drug administration, subcutaneous route of drug administration. The basic example blindly you have to remember is the insulin. Just remember insulin. I've written it upwards, so you can guys just click on your head whenever you hear subcutaneous, think of insulin. So the benefits, it has longer duration of action. Now it can be self-administration, right? Of course, the diabetic patient, if they are type 1 type, or in later cases of type 2 as well, the insulin has been prescribed subcutaneously and the patient itself can administer the drug itself. These are the benefits. And the drawbacks, irritants can't be given through it because it can lead to, but these irritants can be given through intramuscular or intravenous route, and these irritants can cause skin necrosis. That is why this is a drawback. Example, adrenaline, epinephrine, insulin. These are the hormones. You can remember the peptide hormones. And again, MAB, monoclonal antibodies, and octreotides, again a kind of protein. The rectal route, okay, the benefits, 50% lesser first pass metabolism, just remember, than the oral route. 50% lesser first pass metabolism than the oral route. Irritants can be given through rectal route, which can't be given through subcutaneous. Drawbacks, variable absorption, again, person to person it will depend. Now the example, rectal diazepam for in febrile scissors. Now the transdermal, there are transdermal patches which are actually applied on the skin surface, and this leads to the slow absorption of the drug. So the benefits, this actually leads to the very long acting action of the drug, very long, the only type that leads to the very long action of the drug, and there is no first pass metabolism. These are the two benefits. Now the drawbacks, only lipid soluble drugs can be used. Of course, only the lipid soluble drugs can be used. Now the examples, scopolamine for motion sickness, scopolamine, it is also known as the truth serum. It is used for anti-narcotic testing. Next is nicotinic patches, Pantolin, and estrogen, just another example, remember, for estrogen therapy. Moving on to the intradermal route of drug administration. Right, intradermal route of drug administration. It has slow absorption again, and the drug that can be used are like vaccines and others for sensitivity testing. Okay, it has the slowest action. So for sensitivity of action, vaccine and drug testing can be used, so that we can have an idea. For penicillin and BCGs, you can remember. These are the only examples. Now moving on to the local routes. First of all, the topical ones. Local, of course, to a particular area it will work. Topical, it will be applied on the surface, not inside or beneath. So like skin, antibiotics, analgesics as in ointments, cyclosporin, and steroids. Eye drops, it can be given like anti-glaucoma drugs, antihistamine, H1 antagonist, precisely. Steroids, analgesics occurs in ocular pains, in ocular pain. Now, for mucous membrane like bladder cancers, uh, cystitis, and anginal candidiasis. Now, intrathecal, in the inside the layers, inside thecal means layer, so inside the layers, like arachnoid space, subarachnoid space. The benefits can be, it can cause rapid CNS action and can pass blood-brain barrier like aminoglycosides for CNS infections, methotrexate for CNS leukemia, and local anesthesia and mucus muscle relaxants like baclofen. It is an example, baclofen. Just remember. Other can be intra-articular, in the inside the joints. We can apply like steroids like rheumatoid arthritis. In rheumatoid arthritis, whenever you hear articular, just think of joints, and joints is actually related, mostly related to the hot topic, which is rheumatoid arthritis, so you can remember it this way. And the final type, I didn't have the space, so I just write it here. The intra-atrial, which is particularly arteries. You can directly inject into the arteries, so it has no first pass metabolism, and the example can be anti-cancerous drugs, CS for cancers. I hope you like the video. Thank you, and have a nice day.